everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Krista Hawk. She's SVP of Sales and Marketing at e4health, and Todd Goughnour. He's VP of Health Information Management at e4health. Welcome.
Thanks
for having us.
Thank you very much.
Yeah, excited for this discussion. We're here at the HEMA conference, and you guys just did a patient data quality survey with Chime. I mean, it's a really hot topic. In every healthcare conference I've been to, I think it's data quality. But before we dive into that survey and some of the results and what you're seeing, Krista, tell us a little bit about yourself and e4health.
Yeah, hi, I'm Krista Hawk. I'm the Senior Vice President of Sales and Marketing at e4health. I joined the company about a year ago. I've been in healthcare for more than 3 decades.
Wow.
And much of that focused on health IT. And e4health is a national consulting and services firm. We have a health IT division, an HIM division that Todd runs,
Okay.
as well as we offer mid-revenue cycle services, so coding, CDI, auditing, and education. And we've been in business for more than 20 years.
Wow,
and
that's awesome.
have served over 400 health systems in the country.
Great. Todd, how about yourself?
Todd Goughnour, Vice President of our Health Information Management Division. I've been with the company for 15 years. I'm an RHIA myself. Started in the trenches with prep, scan, QC and managing paper, and really learned all the patient data quality from that. So I lead our efforts in our HIM division here.
That's awesome. You've seen quite the evolution, I think. I think we all have.
Yeah.
For sure. Well, Todd, talk to us. Is patient data quality a C-suite concern?
So it's funny you should ask, because I think that's our major offering to the organizations we work with, is really data cleansing, data migration, and data quality. And we know our customers, but we wanted to really hit in on the market and what they actually feel. So we work with Chime, and we came up and did a survey to really try and hit on what the market really feels like they know their quality on. And the results are actually saying more so that only 58% are really focused on data quality, which is a surprising fact to learn. And that's what we bring to our customers to help them try and figure out.
Yeah, it's interesting that I would have thought that number would be higher, but I guess maybe ignorance is bliss for some of them until it's not. Krista, what would you add to that, from what you've seen from the survey results, and talk to us about health systems and how they're approaching data governance committees and structures. What did the survey say about that?
Yeah, well, it's not surprising that 58%, only 58% that said it was a priority also said that they have governance committees established around their data. However, we do see a bigger and bigger focus on this topic. Some organizations, we're seeing that they're hiring chief data officers, sometimes reporting directly to the CEO. So there is promise.
Yeah, that's a progressive organization.
Exactly, right.
Interesting. And, I'd love to hear, what's the impact when they don't focus on quality data? I mean, you lived it, right? As an HIM professional, what's the impact when you don't focus on data quality?
I sort of look at it as information is power, right? And your decisions would hopefully be made by informed data. You could be making a wrong decision that's very apparent, but if you have inaccurate data as part of that, you're making decisions that you don't even know might not be the right decision. There's huge impacts to it. It's clinical care, it's revenue, it's risk mitigation. There's so many things tied to that data quality. So being able to come in and look at it and assess where you're at, current state views, getting a real understanding from a CIO or anyone in that sort of space on how they really feel, but being able to affirm how they really feel. So you don't really know what you have until you really look into it. You can't just pull reports and say, hey, this is my data. You don't know if that's right data in the first place. So as you look forward towards research, analytics, AI, you can't go load AI with a bunch of bad data, because that's going to make decisions you don't want them to make. And you're going to use those informed decisions from it. So that's sort of my viewpoint on the whole situation is informed decisions are all driven by data. And if you got the wrong data, you might not be making the right ones.
Yeah, it's such a good point about AI is going to use that data. And if it's not quality data, the results won't be what you want. So, Krista, what else did the respondees say about data quality? Kind of where are we at with quality today?
Not good.
Not good.
So 56% of the organizations that we surveyed said that the quality of their patient data is either low to medium. Think about that, 56%.
And they know.
They know.
They've run the reports and seen.
Right. So tremendous opportunity to really increase the focus. And again, to add on to what Todd was saying, the patient data is the most important asset that a healthcare provider has, right? And so it's extremely important to ensure that all the patient data is pulled together, one patient, one record. You have a complete and accurate record for each patient.
Yeah, you're saying all of the data together. What are people planning related to like legacy data as more and more data is created over time, and we're seeing lots of mergers and acquisitions. So now, there's lots of legacy data out there. What are you seeing in that regard?
Well, we asked a question about that as well. So we found, again, back to the magic number, 58% of organizations said they still had data in legacy systems, right? So when you think about an organization that's migrating an EMR, for example, right? Obviously, they're not going to put it all in the new EMR. And in many cases, there's 200 to 300 systems that are being displaced when you go to some of these new systems.
Absolutely.
And so, 58% say they have data still spinning in legacy systems. We also asked a follow-up question around what they plan to do with that data. 60% said that they eventually plan to move it to an archive, which is the right thing to do, have it all locked up in one place. And then another 40% said they were just going to keep it in the legacy systems.
Interesting.
Which is amazing.
So it's interesting you say it's the right thing to do. I agree, as I've dove in, but why are people hesitant to do that? Is it a cost thing? Is it a resources? Is it just not understanding what's out there? What do you think is holding people back from embracing these legacy archives?
I mean, it's a timing and cost thing for certain. We work with a lot of organizations that are migrating their EMRs to help them develop their data strategy, their patient identity management strategy, to do MPI cleanup, document management, abstraction work. And the forward-thinking organizations know that they should really focus on that opportunity to clean up their patient data when they're moving it. And then surprisingly, there are so many organizations that really don't have that as part of their overall game plan.
Interesting.
And then, 11th hour, they might decide that they
what are we going to do with that?
I probably need to start looking for an archiving vendor. But it's costly, right, to keep all of that data in all those legacy systems. But the other thing is, with the focus on cybersecurity, the more places that you have patient data, the more points of access, the higher your risk. Yeah,
with software that's not being updated.
Exactly.
Yeah, I find they wake up when the CFO gets the bill from the former EHR and they're like, wait, why are we still getting this?
Exactly.
You're typically going to pay for it later. A lot of folks, as part of a migration event, you're going to look at the data. How much you look at it's up to them. But a lot of folks don't want to, take off the blanket, so to speak, really look at it. It's not like you're going to change what's already happened, but you have an opportunity to do so. And that constant focus to keep on that accuracy is really important. Yeah. So that's what we try and focus on.
Makes sense. Yeah, and you mentioned, Todd, there's a lot of uses of data analytics, AI. A lot of people are doing research on the data. Krista, what would you say you would recommend to health system CIOs as it relates to patient data quality and making sure they have that quality data?
Yeah, I would say the C-suite in general, right? Really understand what the quality is of your patient data today. Again, as I mentioned before, if you're going through an EMR migration, don't miss the opportunity to really focus on cleaning it up. But if you have already done that, establish a governance committee, really do a current state assessment and understand where all your data is, right, in what systems. Do the people that need it have access to it, not only the providers, but the HIM department who have to worry about the legal health record and release of information,
Good point.
right?
Yeah.
You know, your revenue cycle team, there are some statistics that say 1/3 of all claims are denied due to inaccurate patient information. So there's a lot of rework being done within an organization because the quality of that data isn't clean.
That's amazing.
Yeah.
Todd, what do you think the future looks like for an organization that chooses to focus, was it the 58%, focusing on data quality versus one who hasn't made that their focus yet?
You know, it's sort of, I don't think enough folks tie it back to the clinical care. And it is patient focus, and it is taking care of your patients, and that's what's most important. There's a lot of holdbacks that hold people from doing that. I understand that part, but if you still focus on that, that's what's going to put you forward. You know, you have competitors out there, you're in the same markets. You need to make sure you're having the data to make those informed decisions, but you're also taking care of the patients at the same time. And you don't want a doctor looking at a patient or any sort of clinical care provider that's using not the wrong information to take care of that patient, or going into the wrong medical record that someone else is registered under. So it's really important to focus on that. So future for them is just being able to affirm where they're at. You know, if CIO has a bad feeling, like these CHIME results say, then, okay, well, what are you gonna do to really establish what you know about your data and look at it? Okay, well, we can make these little tweaks here. And hey, the CFO's focused on denials. Okay, well, 1/3 of those are coming from, and you gotta refile, and that's 15 cents per refile or whatever it is, I don't know, but that adds up. So you're looking at that risk aversion of revenue, you know, and that's what's important next to the patient care.
Yeah. It's interesting to bring up both the patient care, the revenue, and also the security that you mentioned before. You know, those are all such important topics. And, you know, as I look forward, I see a future of, you know, reliance on AI. You know, sure, right now it's the assistant, but as the assistant gets better, we become reliant on it.
But where are you going to tell that to go? Yeah. So every duplication of the data that you have that you might not even know is also double your risk of, you know, any sort of security threat. Sure. But also, where's that AI looking to make those decisions?
Oh yeah.
So you got to fuel it the right way.
But it only happened once, but the data was
exactly. So you got to fuel it the right way. You have to, AI's here, it's going to help, but you have to fuel it with the right stuff. Exactly. And I think that's a real key of looking at this stuff now as AI keeps coming in and doing more and more, which is great, but you need to make sure you're fueling it with the right data.
That's awesome. Todd, Krista, I appreciate you taking time to sit down with me at the busy conference. So love hearing your insights, and thanks for sharing the results from the survey. And thanks everyone for watching and listening.
Thank you.
If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks so much.
All right. Thank you.